ICUs and hospitals are feeling the pandemic pressure. This week's number of patients in ICU beds nationwide is at levels not seen since May. Ashley Sampson looks at the systems hospitals use to give patients the best care when doctors worry they're about to be overrun.
Dr. Todd Vento has spent most of his professional life preparing for the worst case scenario. He's an infectious disease specialist who previously worked for the Department of Defense, managing the Ebola outbreak in West Africa. He's since been recruited to fight on the COVID front lines.
When you prepare and live in that world of constantly preparing for a true threat, you do expect that it could happen.
In video provided by Intermountain Healthcare and University of Utah Healthcare, you can see states in the Mountain West are reaching a critical tipping point. The talk of moving to crisis level of care is imminent. One example, the Utah Hospital Association is reporting double the number of COVID patients in hospitals from 2 weeks ago and 5 times the amount of patients from 2 months ago. So what happens at hospitals when numbers surge? The process of load leveling happens first.
Balancing out where the patients are so you don't have one facility that might have 110% of capacity, while another facility is at 70%.
A patient management system called Care Traffic Control covers 7 western states. Like other systems in the country, it tells first responders where they can take patients. Next comes Contingency Care.
And that contingency plan might be an example such as, well, we realize, okay, we're going to need to take care of more COVID patients, so maybe we convert another hospital that can take care of non-COVID patients.
Part of the contingency plan also means canceling non-critical surgeries. And finally, crisis levels of care.
The concept or the term of crisis standards of care really gets down to a similar concept in combat in the military, and I know that may sound harsh, but it's really about triaging.
Meaning doctors will be forced to make tough decisions about who gets care and what that'll look like. As many states smash records of COVID cases, healthcare workers are being stretched thin and asking for help.
It's up to us to allow all of our livelihoods to continue.
I'm Ashley Sampson reporting.